Hey everybody, and welcome back to another episode of the Physiotutors podcast. Today we have with us Brodie Sharpe. Brodie is a physiotherapist out of Australia. He's been practicing, I want to say, since 2012, and he's an avid runner himself, competing in half marathons, triathlons, and he also is the host of the Run Smarter podcast. Something that we'll be touching on a little later on in the show is the theme of the month coming up is going to be recovery on the podcast as well. So, for us physios, athletes listening, I think it's going to be a good listen for you. Brodie, that's enough from me. Why don't you take a couple minutes and introduce yourself to the audience, and we'll jump on in.
Thanks, Sonny. It's a pleasure. So yes, I am from Melbourne, Australia. I graduated from physiotherapy in 2012, and I was probably about 3 or 4 years into my physio career that I became a runner, recreational runner. I grew up playing basketball, and then when that career kind of ended, delved into running and recognized that when I would start seeing runners in my clinic after I became a runner myself, I just had like this heightened passion to get them back on the track, like overcome their injuries, teach them a whole bunch of things. And that passion and that enthusiasm, I recognize within myself, I want to spend more time around that population. And so started venturing out into like the podcast being one of them. So my podcast helps educate runners how to make smarter training decisions and reduce their risk of injury and help their performance, help their recovery, that kind of stuff. And ventured out on my own doing online physio. So my clinic is the Breakthrough Running Clinic, and I only do online consults, and it's only for runners. So I try to hone in on that niche. And a lot of my studies, a lot of the research that I try and do is just to stay up to date with how runners do get injured, how we can educate them to reduce their risk of injury. I interview a whole bunch of researchers and health professionals to help me with that mission of bringing like a lot of clarity and a lot of control to recreational runners. And it's a very common situation that runners find themselves in when they do get injured. They're not too sure what to do. They go to those who do go to a health professional. We hope that they're well versed in how to treat runners, but usually their first step is jumping onto Google or jumping onto Facebook groups or jumping onto asking friends, asking running coaches. And they say like, how do I get better? I've got this, pain in my knee. What do I do? And everyone's like, foam roll, stretch, do all these kind of things that is contradictory in a way. Some people say you need to run. No, you need to rest. You need to ice. You need to heat. You need to foam roll. You need to stretch. Don't foam roll. It makes it worse. And then they're just confused. And so that's what led me on the mission. And that's where I'm at today.
That old chestnut of diving into the Reddit group or the Facebook group and hearing literally every which way it can be. It's a nightmare to try to traverse. All right. With that being said then, what would you say are the majority of the sort of cases that you would see in your patients as for your runners?
Yeah. So the evidence would show that like if a runner does come in, the prevalence of knee injuries are the top of the list. Patellofemoral pain's normally what you would see in clinics. But for me specifically, when I'm doing this online stuff, it tends to be the ones who have been injured for a very, very long time. And then they find they're kind of just desperate and they're like, oh, they've listened to my podcast or read my blogs or something. And then it's kind of like a last ditch effort. Unfortunately, that's what it's like at the moment. And the two conditions that I mainly see are proximal hamstring tendinopathy and plantar fasciitis or plantar heel pain, whatever the term you want to use. And why those two are coming towards me is they do get very, very chronic if you mismanage them in the early days, and they start to affect day-to-day life, like really, really quickly. If you've had it for months and months and months, and then all of a sudden sitting's an issue or standing for long periods of time of issue, it starts to affect your work. It starts to affect, going out in your social life, and it can really have this downward spiral and be really, really debilitating. So that lingers on. And I'd say the average time I've had someone with an injury is probably been about 2 or 3 years is the average time frame someone will have this injury before they see me. But yeah, that's the minefield we have to work with, and they're the usual common cases that I see online.
It's one of those things, isn't it? I think when we had Ben and Glenn on the podcast, they mentioned that with runners, usually they don't go to seek help until it's at that point where they can no longer run. They're not going to try and nip it in the bud early. They're going to wait until it's to the point where either your day to day, like you say, is affected, or you can't run anymore. And then they're like, oh, okay, maybe this little niggle isn't going to clear up anytime soon. With that said, then, like you mentioned, one of the things that you see runners find a lot online is go on, have a rest, and you'll be okay in a couple of weeks. And it's something I had someone in clinic last weekend, actually. She goes, yeah, I thought I'd take a rest for a month and then went back to it and the injury was still there. So how do you feel about the advice of just rest it and you'll be all right? And how detrimental can that be for people?
Yeah. To touch on your first point, when it comes to runners seeing health professionals, it'd be almost with every runner, or with every patient that you'd see in the clinic, but there's a certain motivational threshold that, oh, I'll put it off. And then it's like the motivation is through the roof as soon as it's not necessarily the pain becomes too severe, but it's what it limits you to do. As soon as that limitation becomes something that really is really significant for you, that's when motivational levels go through the roof. And a lot of runners, they can run through pain. They can do it, in most cases, they're like, yeah, it's a niggle. Yeah, it's pain. Yeah, I've had it for 6 months, but I can still run. And when it gets too severe that they can't run, that's when they book in for physio the next day or the next hour. It's like, this needs to be taken care of. And uh, another example I like to use is people with low back pain. They'll put up with low back pain for 6 months until it gets so severe that they can't work or they can't play with their grandkids or something really significant in their life. Once they're unable to do that, then they book in the next day and it's urgent. They need it fixed within a couple of days. And unfortunately, that's the motivational levels of or what sparks motivation for a lot of people. But a lot of people put off going to a physio as a runner because they think that they're just going to tell them they can't run. They think they can't. All they're going to tell me is that I can't run and I need to run because of all the psychological benefits. I just need to do it. Like, they get jittery if they don't run. And so they don't see a physio or they don't see a health professional because that's what they think is going to happen. And a lot of times they try and rest it themselves and just see how it feels. And this is where I talk about this concept called the pain, rest, weakness, downward spiral, because a lot of running related injuries are due to overtraining. They're just like overuse injuries. And what happens with an overuse injury is the tissues, like the ligaments, the muscles, the tendons, they become overactive, they become a little bit sensitive. And in that sensitive state, they can't tolerate the same levels of load that they used to. And so to put it another way, they become temporarily weaker while they're in that sensitized state. And a lot of people interpret this as, okay, I'm injured. Yes, I know I had a spike in my mileage. Yes, I know I'm injured. Let me just take a week off, or let me give me a couple of days off and let's see how things feel. And you're taking that sensitized, weakened state and treating that with complete rest, which further weakens those structures. And then a week later, when you try and go back to running, it's often your pre-levels of running. Most people say, yeah, I got injured at the 10K mark, so let me just run 10Ks. And you're taking that weakened structure and you're running on it again, and it becomes sensitized because you've overloaded it once again in that weakened state. And a lot of runners interpret this to think, oh, maybe it's just not ready yet. Maybe it's just not healed yet. Let me take some more time off. And so they completely rest again. It gets weaker. And then as we follow this downward trend, it becomes more and more sensitive. It can tolerate less and less load. And then all of a sudden, a 10-minute run starts to flare things up, or half-hour walk starts to flare things up. And then maybe just going upstairs starts to flare things up. And this pain, rest, weakness, downward spiral keeps repeating itself until it gets to the point where, you can't really tolerate a lot of day-to-day life. And what we need to do is try and catch you at that, as high up that downward spiral as we can. We need to catch you as early as we can as you're trending down that spiral, and treat you with active rehab with some like strengthening exercises that you can tolerate, and then work your way back up.
Would you then look at that and say, look, complete rest isn't advisable, we're going to put the running down for a while? Or would you say, hey, what we're going to do is adjust your running and then we're going to go on the strength side of it for a little while? What's your approach there?
So often, if you catch an issue early enough, it is just as simple as changing their training. Like you have a runner come in, they've got a sore knee. You will say, okay, let's just say they've had a couple of days of knee pain. What has your training been like the last couple of weeks? If you identify either like doing too much too soon, like if you start to identify a spike in their training, or if you identify an abrupt change, so that might be a change in terrain or a change in the type of shoes that they wear or something in their routine that's way too abrupt, it might just be as simple as educating them and changing their structure. So instead of doing a 50K week, let's back off to a 30K week. Then the next week we'll do a 40K, and then we'll slowly ease back up to that 50K. And that's all that needs to be done. It can be as simple as that if you've caught it early enough and it's not in this really sensitized state. If it is really kind of flared up and really irritable and they've got pain with walking or squatting, you might need a couple of days off of complete rest. Like 2 days, 3 days max is fine. But if they're at a stage where they're too sensitive and they can't run, that's when we substitute in some strengthening or some level of loading that they can tolerate. That might be just doing some basic like wall squats, or it might just be doing some low step ups or lunges or something that they can tolerate that doesn't flare up their injury, but we're still activating those tissues and we're still trying to load those structures as best we can.
I mean, with you doing that online, how are you gauging where somebody is? When I'm in practice, I find it quite nice and relatively straightforward to gauge just where someone is in terms of their current pain, how long I think the injury is going to take roughly until we're back on the right track, depending on how they respond with the exercises and whatnot. What sort of things are you asking them about during your questioning that you can turn around and gauge where to begin with them?
Yeah, I'm not too sure if many people follow Tom Goom's work, but he's a running physio that is very well knowledgeable in this space. And he often talks about, okay, you need to identify their levels of load, and you also need to identify their irritability. And that can just be through asking them the right questions. What can they currently tolerate? If it does flare up after doing a certain run, how long does it stay flared up for? These sort of questions obviously can be done online, but just asking the right questions helps gauge that level. So you can, with experience and with asking the right questions, you can say, I have a fair amount, or I'm confident they're probably able to tolerate this certain level of load. Let's see how they go. And it's kind of like a trial and error. So let's just say we have that runner with knee pain come in and they're very irritable and we're not too sure where to start. You might ask them, okay, how are stairs? How's jogging on the spot? How's hopping? And you might just get them to, like, if we're talking about online, they can easily do that through like Skype and just talk me through their experiences doing those tasks. And then you can just gauge, okay, how'd that feel during? Is it irritable afterwards? If based on that response, we can get a similar gauge and then just start them off with something. And that something is just like a little experiment. It might be a 5-minute run, or my return to run program is 5 minutes of walking followed by 3 rounds of running for 1 minute, walking for 1 minute, and then finishing with 5 minutes of walking. So not a lot at all, but that just might be a little experiment for someone who is quite irritable just to start. And then we're gauging how they feel afterwards, how they felt during, what the level of irritability is like afterwards. And the way my online physio is structured is they sign up for either 1 week of physio or 1 month of physio. So it always starts with an online consult. But then after that, it's just touching base with them as often as they need. And so you might send them off the next day to do that run, that return to run plan. And then they're just emailing me or messaging me the next day, just letting me know how things felt. And then I'm just giving them instructions after that to be like, okay, this is the response. This is what we now know because of that response. These are the next action steps. And so you're kind of like coaching them through that process. And so to answer your question, you're gauging their level of tolerance, you're gauging their level of irritability with some simple tasks and asking the right questions. And then you just start with something. And if it does flare them up, we know that it's not going to flare them up for very long because you've only just given them a little dose. And just based on that experiment, based on that trial and error, we're just like changing our decisions based on how they're feeling.
In your rehab program, do you purely work on the strength side of it, or do you look at the dreaded stretching or foam rolling, or how do you, what's your approach with the rehabilitation side of things before we start talking about the return to running?
Yeah, so most of my rehab will first of all involve education. The right type of education is the cornerstone. It's like the foundation of everything you need moving forward, because a lot of people, a lot of runners have a lot of unhelpful beliefs about their injury. They think that if they load up a tendon through pain, it might increase the level of damage, or the tendon might snap, or they have like deep ingrained fears, and based off things they've been told on Facebook groups and that kind of stuff. Um, so education's a must. Whatever level of running they can tolerate, if any, I do advise that they continue that level of running. Sometimes they might have to back off and have a week of rest if they're really irritated, but active rehab, strengthening, there's tons and tons of evidence. I don't need to tell your listeners that the amount of evidence it has for rehab and strengthening when it comes to any overuse injury or any injury. The stretching, not so much. The foam rolling and all those kind of massage balls, those sort of things, I don't weigh too heavily unless they've tried it before and they think that really helps them. For example, if they have, say, ITB soreness or ITB pain, and they think that doing some light stretches really helps them, I'll say, by all means, do it. It's not going to make it worse. The only thing that stretching might make worse is like a high hamstring tendinopathy. Sometimes it feels good in the moment to stretch that area, stretch that sore area, and really get to that deep-seated pain. But it's been shown that like constantly static stretches of the high hamstring isn't helpful at all. So I will tell, in those certain circumstances, I'll tell them not to. But when it comes to the evidence of stretching and foam rolling, it's not very highly weighted. And so I'll focus more on the education side of things. I'll focus on making sure they're at a level of functioning that they can tolerate. So whatever level of running that might be. And then I'm giving them some strength exercises and making sure that they're doing that appropriately, making sure they're doing the right technique. And sometimes they send me videos of them doing a complicated move just so I know that they're doing it correctly. And then just, once again, basing it on symptoms, give them a certain level of load and see how they react.
What sort of loading are you working towards then if you're trying to build someone back up to running?
So the goal would be essentially like pre-level running, whatever load. A lot of them are training for something. So they're training for a race. So that would be like the first goal that they want to get towards. So tolerating that level of loading. But the first step is often, okay, getting them running symptom-free, pain-free to start with, then building our way back up to their pre-level before their injury, whatever they were able to tolerate, and then just basing on whatever goals they have after that. Because the one thing about running is it's so open-ended. Like someone can run for half an hour and just be totally happy with that. Others, they want to train for a half marathon, then quickly to a marathon. Then some crazy ones go on to the ultras, and then they go on to an Ironman or something like that. And it's so open-ended. They just constantly try and push themselves greater and greater and greater. And it's just basing on the individual, like what sort of needs they have, what sort of requirements they have. But I like to talk about the runner having like just being resilient as they can. And so trying to make sure that their recovery is optimal, making sure that they have a good level of strength, making sure they're doing some regular strength and conditioning amongst their running program, because that has been shown to increase their resiliency. And then just making sure that we're ticking all those buckets before they start like really ramping up their mileage, and also making sure that the program itself, the running program itself, is really well structured, really well designed. That way we're sort of adapting to them. We're adapting to their needs and whatever high-end goal they might have. We're sort of staying on top of all those.
With regards to their strength and conditioning that you're aiming for people to be doing now, is that sort of body weight work, or are you asking them to start lifting a little bit of weight? Or
So it's a very tough conversation to try and convince runners to do some strength and conditioning work. It's a very tough obstacle because they just want to run. If we tell them that it will help their performance, their running performance, and can potentially reduce their risk of injury. Most of them are on board and they'll go, okay, you've convinced me. I'll do it once or twice a week. I'll go to the gym. But then once they're in the gym, they love doing some body weight stuff because they're endurance athletes. They thrive with the body weight exercises. But the evidence shows that if you want to really increase your running performance, it's kind of contradictory to what instinct tells you. If you are an endurance athlete, you should train your muscles in the endurance component. But the evidence does show that runners should be aiming towards the heavier side of things. So 8 to 12 rep max range is just with some basic squats, lunges, deadlifts, definitely some calf work, whether it be like seated calf raises, standing calf raises. Those sort of basic exercises need to start slowly head towards the heavier, lower rep range. That's where the evidence shows that the physical performances, even for endurance athletes, that's where it comes in. And potentially doing it twice a week won't disrupt your running program too much, and you'll start reaping those benefits.
Depending on where or what the injury is, do you then modify the exercise program in terms of concentric or eccentric emphasis in the training at all? Or
You definitely can tailor the exercise based on the injury that they have or based on their weak points. So you definitely want to have some single leg work in there, no matter what the injury is, because a lot of people get away with they maybe unconsciously cheat. Like if they do like a squat, they feel like they're getting strong. They feel like they're doing like they're distributing the weight evenly. They feel like they're getting stronger, but as soon as you do some single leg work, that affected side is nowhere near the strength and power and confidence as the other side. So no matter what the injury, always single sided. And then it's just based on like the type of injury is where the physio knowledge comes into it. So you'd know that if you have plantar fasciitis, we can bias, say, a single leg calf raise with big toe extension or toe extension while we're doing our calf raises to really load up that fascia. Or if they've got like knee pain, we want to make sure that like the ranges that they're working, we're considering the knee ranges they go through. It's just having knowledge about each of those specific conditions and not necessarily concentric, eccentric loads, because I think everyone can benefit from, as a runner, you can benefit from really loading up the eccentric component and doing that slow eccentric phase followed by a fast concentric phase. That's really good for running performance. But yeah, that's where the physio skills and the knowledge of the specific injuries can really start to tailor for that runner.
how much S&C work do you recommend alongside the running for someone? Let's say if you've got a runner who normally goes 6 times a week.
A runner who normally runs 6 times a week?
Yeah, 5-6 times a week, let's say. How would you then tailor their program?
If they're running 6 times a week, we could probably substitute out one of those running sessions for a strength session. And like usually if you want to build up strength, if you're not much of a gym goer and you wanted to get stronger because you know the benefits that strength and conditioning does have, you'd want to start with at least twice a week, 2 to 3, but you can usually get away with twice a week doing some strength and conditioning work. If someone's training for a marathon and they're getting towards, say, within a month of their, let's say within 6 to 8 weeks of their event, we can then take out one of those strength and conditioning sessions per week and just keep one session in. And so the way I like to describe it is the 2 or 3 sessions per week helps build up your strength, and 1 session per week is the minimum amount to maintain that strength. So you're not making any gains, you're just maintaining the strength that you've gained, so that we can probably maybe replace either a run to make it more specific for what we're training for, or an extra rest day if they're doing some high mileage and we need to prioritize recovery. So once a week just to maintain the gains they've made. That's like the bare minimum amount. So that's usually my recommendation, and runners tend to get on board with that. It doesn't sound like it's too much of a task. It kind of sounds manageable. So that's what I'd usually recommend.
What about with regards to that recovery then, alongside their training that they're currently doing, whether they run twice a week and do 1 time a strength session, or if they're doing 3 times, 4 times a week and doing 2 strength sessions? How do you then load that up with recovery or active recovery or what have you?
It would depend on the individual. It depends on how much they're bouncing back. It depends on like how experienced they are with strength work, what their age is, because we know that the older you get, the longer it takes for you to bounce back from harder or longer training sessions. So you might need to do some more complete rest days. This is where it gets a little bit creative and it becomes a little bit more of an art based on that individual. So you might say, put them through 2 strength sessions a week, followed by their 4 running sessions. And they're constantly feeling a little bit tired. They're constantly feeling a bit sore. They're not really feeling fresh for their hard running sessions. Then we need to start tweaking a few things. And one of those tweaks might be combining one day of a run and a strength session. So you're combining those 2 sessions into one day, hopefully one in the morning, one at night. And then when we combine those 2 sessions, we leave the next day for complete rest. And so they're actually getting more recovery days. The other thing could be just making sure that when they are running, a lot of like the bulk of their running mileage is at really low intensities. So there's not much research around it, but people tend to have the 80-20 rule. So 80% of your running weekly mileage should be at really, really low intensities at like a conversational sort of pace, a conversational type of intensity, whereas 20% should be that really peak, harder sort of training sessions. So if someone's not recovering, I would definitely make sure that they're well structured, but I would definitely make sure that they're ticking all their recovery boxes around sleep, around nutrition, around hydration, just making sure that that component of things is being addressed, because that's what the evidence shows. If someone really needs to recover, they really need to have good quality sleep, they really need to manage their stress levels and hydration, nutrition, all those sort of things.
Would you say there's much difference in how you take that approach if someone is an endurance long distance runner or if they're more of a track sprint athlete?
It's a different conversation for sprint athletes. Like if they're really short distance track, and it's kind of not, I don't really see any sprinters. They would definitely need to do a lot of power work. They definitely need to, their training sessions would be totally different to a recreational runner or an endurance athlete. But when it gets to say 5K, 10K and beyond, it doesn't matter. Like you'll still reap the same benefits with the strength and conditioning work, still working at the same dosage. So if we're doing that 8 to 12 rep range, you'll still receive the benefits, whether you're a 5K runner or whether you're a marathoner or an ultra runner. Those strength and conditioning metrics, that dosage will still reap those rewards. I think the sprinters are need to be treated a little bit differently. It's kind of like a different sport, but the endurance side of things, no matter what distance, you'll still receive those same benefits.
With the endurance athlete injuries that you get, do you ever see any relation from their injury into their running techniques or anything? Or is that something that generally speaking, you find that their technique or their cadence isn't an issue? It's more so just an overuse thing?
Very, very often there'll be some sort of either overtrain or under recover. You'll find something in their training beforehand that's, like I said, too abrupt or too much too soon. And it's kind of like what type of injury develops would kind of tend to be around what their cadence is like and what their technique is like and what they're like as a runner. That's what I tend to find. But there's almost always a component of overtraining or under recovering. So someone might have an overuse injury and their training has been consistent the entire time. However, perhaps they've at a stressful time in their life where they've got a new job or they've got a new baby or they've moved house and they're not sleeping well, they're not eating well, and they're trying to train at the same amount of load. They are at increased risk of developing an overuse injury. So number one, you want to make sure that they're training, or we've identified any overuse training, that sort of thing. Depending on the injury they have, there is some evidence to show that gait retraining might be of benefit. So if they do have knee pain or if they do have lateral hip pain and they are showing like a crossover gait or hip internal rotation or hip drop, there's some science emerging that those links can be linked to injury, and some gait retraining can be really beneficial. But it would depend on the individual. We can't have these blanket statements that you will get injured or you have an increased likelihood of injury if you overstride, or if you have a really low cadence, or if you have a crossover gait. We have to really match to the individual. And like I said, it's usually a combination of the biomechanics, but always in combination with some sort of overtrain or under recover.
You touched on a little bit there of the sorts of injuries you might see if it is related to cadence or technique. Can you dive a little bit deeper there?
Yeah. So if I was to change anything around a runner, so if a physio has the runner in their clinic and they want to look at them on the treadmill and analyze some of their running to see if they need to make any changes, definitely one would be an overstride. If they're reaching really far in front of their body when they make that initial contact, that has been shown to create a fair bit of braking force, unnecessary braking force through the body, particularly through the knee. And we want to try and minimize that braking force as much as we can. And so if you are noticing, identifying within your runner that they are overreaching and their contact is really far in front of the body, try and correct that and do that with some gait retraining. And a lot of that can be with cadence. And you might find that if you just increase their cadence slightly, it corrects a lot of things. They no longer can overstride. They no longer can have this crossover gait. And it sort of just magically corrects things in itself. It just becomes a more efficient way of running. And I wouldn't change cadence for everyone, but when I first graduated, they had this magic number around 180. 180 is the magic number that everyone should be aiming for. And if you are under 180, you should be increasing your cadence. I should probably describe. So cadence is the amount of steps that you take per minute. And someone who has a really low cadence, let's just say around the 150s or so, they're going to be like bopping up and down, really like, it's almost like they're running on the moon. The really slow tick over of their legs. Their vertical translation the amplitude is quite large. And it's been shown that you can become a more efficient runner if you start to increase your cadence. So you're taking shorter steps and you're ticking the legs over a little bit quicker. We're traveling at the same speed. Speed is irrelevant, which is why treadmills are really nice to have that consistent speed. But we're just trying to take shorter steps. And so we're reducing that overreach. We're reducing the time it takes for you to cross over to the body if you do have a reduced step width. So if I have a runner who's around like the 150s, 155s, I would play around with increasing their cadence by like 10%. Science shows that any increase between 5 and 10% creates a significant change when it comes to forces in the body. But if someone comes in and they've got knee pain and their cadence is quite nice, their cadence is around like 165, I'd be happy with that. And I'd probably not do any gait retraining at all and just focus on their training, focus on their running program, focus on strengthening, all that kind of stuff. And gait retraining might not be high on the priority. So I'm not sure if I answered your question. I was kind of muffling on a little bit, but I guess looking at, you want to try and find a consistent pattern to the runner and the injury that they do have. So you can obviously find anything. There's no perfect running technique. I wouldn't focus on changing everything because you will spot something that's kind of not ideal, but that might not necessarily be in relation to their injury, and we're just changing it for the sake of changing it. So really make sure that when you do any gait retraining or you do notice some non-ideal movements, that it is directly related to the injury itself. And then we just trial and error and see if it does feel better, or see if the runner does feel more efficient or more confident with running that particular way.
Okay. We're going to stay in the murky water a little bit here and talk about the running technique. Now, do you see much benefit in a recreational runner, whether that's someone who literally just runs for a bit of fun, doesn't want to do a marathon, doesn't want to do a 10K or a 5K, just doing it to blow off some steam, or for the people that do want to do that? Do you see any benefit in modifying them to a sort of forefoot strike or anything like that? Or
no, there's a pretty simple answer. If they are overstriding, then definitely we need to change something because we just want them to be more efficient. If they're really low with their cadence, I'd probably change that because you want to be more efficient. But if they don't want to increase their running performance and they're not injured and they don't have any like long previous history of like similar types of injuries, we don't need to change anything. They've adapted to the running technique that they have. Their body has adapted to that. And if they're comfortable, if they're happy, if they're enjoying life, they're doing their casual run, definitely let's just keep them as they're doing, because their body's adapted to that particular style. Different story if they've had a long history of Achilles issues, or if they're currently injured, or if they want to increase their running performance. That's definitely another conversation to have. But yeah, for those runners, it's not too complicated. We can just keep them running, keep them happy. The forefoot strike side of things, there's no science to show that a forefoot strike will reduce your risk of injury or increase your running performance. It doesn't really depend on whether you make that initial contact with the heel, midfoot, forefoot. What does matter is how close to the body you first make that contact. So we definitely don't want to overstride. I've said it a couple of times already, but if the foot is contacting like closer to your center of mass, it doesn't necessarily mean doesn't matter what contact you make with your foot. We can be happy and not need to change that.
I think for me in practice, that was one of the very, very important things to realize, what you mentioned there of, if somebody's been doing this for years and they've not had much of any injuries, you don't need to start playing around with their technique or their cadence or what have you, because their body has adapted. I had a fella who's in his 60s or something, and he had literally no dorsiflexion in his ankles at all. And when I was assessing him, and he's like, "Oh, I've got this pain here, blah blah blah," and I saw that immediately as a sort of fresh physio at the time. That for me was this: oh my god, this is tragic. This guy can't dorsiflex his foot past the zero. What the hell is he doing? And I spent weeks trying to address it before speaking to a colleague of mine, and he was like, "Well, is that where his issue is? Do you think that's related directly to the issue? Has he had any problems there before? No? Okay, then if it ain't broke, don't fix it. Let them crack on and address what the problem is and go from there." Coming back to the recovery side of things, are there any sort of tips that we can use as physios in how to gauge someone's recovery and if they're adequately recovering? And is there anything that we can give on to the patients to say, hey, listen, these are the things that you need to look out for your recovery, just to make sure that you don't hit the overtraining zone again?
Yeah. To touch on what you just said earlier, if someone does come in with a new running injury, you're going to find something. You're going to, like all physios, podiatrists, health professionals, we're good at finding something and trying to link it to the injury. So most people find pronation, most people find some sort of stiffness, some sort of soreness somewhere, and we can easily say, this is causing your injury, let's fix it. But when you take a step back and you think these runners have been running that way for years and years and years without injury, it's only now that the injury is occurring. We can't necessarily say it's because of your stiff ankles, because they've been running with stiff ankles for so long. That's why we can't get caught up on a lot of what we see unless it has been an acute change, and if there has been a change in their training or under recovering, that sort of thing. So with recovery, there's not a real way of measuring it. I'm delving into heart rate and heart rate variability and trying to interview a lot of researchers around where we're at with this. And a lot of devices, a lot of sensors will say that they can measure your ability to recover or your readiness to train. Not too sure I'm confident in talking about like an absolute answer. I think it's really, really nice to have as a part of your training, like to use as just one piece of the puzzle to see if you are adequately recovering. But we want to make sure that we're getting the basics right. The basics being sleep, making sure you have sleep and a lot of downtime. I just got off an interview with Shona Halson, who just talked about this. I'll just repeat what she said. She has this recovery pyramid where we want to make sure that we're addressing all the base layers of the pyramid before we start trying anything else. And so the first level of that pyramid was sleep and downtime. So downtime being like de-stress, like psychologically, we want to really have some downtime, unwind, because psychological stress can have the same effects as physical stress. And if you are constantly wound up, if you're constantly psychologically wound up, the body's not going to know the difference. It's going to think that you're under stress, same as physical stress. So want to make sure you have some adequate downtime. The second level being nutrition, hydration. We want to make sure that you are getting adequate replacements, getting adequate nutrients, making sure you're staying hydrated. And then once we move up from there, that's when, if you've covered those bases, you're doing things really well. And we want to make sure that we do have a well-designed program. We want to make sure that you're feeling okay. We want to listen to your body and make sure that you're not feeling constantly stiff and sore. Once all those are ticked, that's when you can start trying the fads and start trying things like foam rolling, massages, compression, hot cold therapies, other fads, just to see if you respond really well to them. There's not a lot of science to back it up, but if you feel good doing it, then it's going to be a psychological relief and it's going to help you recover psychologically as well. So when it comes to recovery and measuring it, you do need to listen to your body, but you do need to make sure that you're doing the basics really well.
Are there any sort of subjective measures that we can use?
Subjective measures would be just like listening to the body, like just asking them, are you feeling fresh? Are you feeling fresh for your hard sessions and for your long sessions? A lot of times they might just be feeling run down, or their legs just feel stiff and sore when it comes time for the harder sessions. A lot of runners get into this gray zone of training where when it's time for a really slow recovery day, they tend to train a little bit too hard. They really don't like the slow recovery type of runs. So they're like, oh, maybe I can get away with working at a little bit more intensity. And then, so they're working a little bit harder than what they used to, or what they should be doing. And then when it gets time for the harder sessions, they haven't really recovered enough to put in a lot of effort or like really perform at a top level. So then they've sort of backed off a little bit and they're unable to perform at that level. So you kind of just start merging into this gray zone of not working too hard and not working hard enough, and making sure that design is really well trained. So just asking them subjectively, what's your training like? What is your structure like? How do you feel afterwards when it comes to those harder sessions? Do you feel fresh? Are you getting good sleep? Are you getting good nutrition? Has there been any changes in stress or daily changes with your work requirements or pressure or deadlines, exams, study, all that kind of thing? Those subjective questions can be really nice. There is a questionnaire that I really love using. It's the Wisconsin Running Recovery Index, along those lines. It's 9 questions that covers pain, like for someone who is injured, pain when they're injured, but also covers levels of frustration, levels of like confidence when it comes to trying to increase your running speed or increase your running distance, seeing what their levels of frustration are like around that, and just covering psychologically a couple of questions as well as physically. So some of these measures as well can be really nice for having some, like just asking those sort of questions can be really nice as well.
Let's say we've got this person into the clinic or online and their recovery is now going well, their strength training programs are going well. When do we decide it's time to get back to running?
This is where the art comes into it as well, and there's no real structure. I would say if they're doing everything really well, they're probably already a couple of weeks into running. I'd say we want to try and keep them running. If they are able to run without a flare up, then we're still keeping them running. And that might be, like I said at the start of this return to run program, might be some really low level running, walk, jog, walk, run kind of intervals. And it's kind of in the same timeline as their strength work. So they're starting off some really low levels of strength as they build up. At the same time, they're also starting with some really low levels of running and building up from there. And so there's no real cutoff of, okay, let's start running. Let's take it on board now. There are some benchmarks that you can aim for, like if they're hopping pain-free, if they're jogging on the spot for 30 seconds without symptoms flaring up, if they've got the same confidence to produce power with their hopping, then I would start with really low levels of jogging. They should be okay to start some levels of jogging. And then just basing on from there, if they're recovering really well, if the next day after their run session, if they're feeling like they've recovered, by all means, let's start another run session. So it's kind of in the same timeline as the strength and conditioning. And if they have like a tendinopathy, if they have patellofemoral pain, the physio needs to decide, like, what level of pain is a good level. There's some really nice research to show that if you put a tendinopathy through low levels of pain, even when they're running, so if they stay at under a 4 out of 10, and that stays consistently under a 4 out of 10 during their run, and it stabilizes after the run, and it's very stable the next day, that counts as a successful run. They might have been running under low levels of pain, but it didn't get worse. It didn't flare up afterwards, and it's fine the next day. That's where I have interpreted that to be like, yes, you've negotiated that level, that load of running. Let's continue doing all your strength work, and let's continue at that same level of running. And over time, we do need to make sure that as we look over week by week, that level of pain is improving, but in the moment, that's still okay to run at those pain levels.
What about with increasing the load that they're able to put through with running, whether that's deciding to increase their pace or deciding to increase their distance?
It would depend on the injury. It would definitely depend on the injury. Some would say that if it's patellofemoral pain, people can manage patellofemoral pain quite well with increasing their speed, because it's more the repetition that causes patellofemoral pain. It's not necessarily much to do with, I should put it another way. So if a runner runs at a slower speed, they tend to have more of a knee bend. They tend to have more of a knee bend at mid stance, which puts increased levels of load through the knee. If they run slightly faster, they actually become more stiff and they don't have as much knee bend when they're running. So it's actually better for your patellofemoral pain to slightly increase the speed. But if we know anything from, say, Achilles tendinopathy, speed has a dramatic effect, or like calf strains, they have a huge influence on the speed that you have. So any increase in speed, it's going to really ramp up that load. It will depend on the individual, depend on the terrain that they're on. It will depend on the type of injury that will say, okay, we're safe to increase our distance or we're safe to increase our speed. In most cases, I'd definitely go off, if I had to have like an umbrella statement, I would say build up your mileage, build up your distance before you build up speed, just to be really safe with a lot of injuries. And yeah, you should be relatively safe.
I suppose realistically, you should have come right at the beginning. What are the sorts of things that you're looking at when someone's running? What are your sort of assessment indicators when you're looking at someone running to think, okay, this is something I need to work on in their training program, or there's some hip drop there, so I need to work on this? What things are you looking out for?
It takes a little bit of experience to find something to know if it's likely to be directly correlated to the injury that they find. So we do know that if they do have lateral hip pain, then some sort of hip internal rotation or contralateral hip drop would increase the load through that structure. And if they're doing it with really low levels of control, really low levels of strength, and they're doing it over and over every single step they take, you're probably going to say to yourself, let's work on a few gait retraining things, a few strengthening things. The strength will build up the level of tolerance, and the gait retraining will help offload or dissipate a lot of that load to other areas of the leg that, yeah, it's sort of like offsets it a little bit. So it makes sense if someone has lateral hip pain. If someone has, let's just say, tib post tendinopathy or shin splints, and they're eliciting a really a crossover gait pattern. So they're contacting their right foot on the ground, but it's all the way over to the left side of their body. That would increase the level, the speed of pronation, increase the rate of pronation and the overall amplitude. And so it makes sense that if they have a tib post tendinopathy or if they have shin splints, that widening that stance would help offload that structure. We're not reducing the loads, we're just changing them to different parts of the body. If someone does have patellofemoral pain and they are overreaching, we do know that creates braking force through the knee. And so we might want to increase their cadence and decrease that level of braking force to offload the knees. I really don't delve too much into the real specifics, like looking at joint angles and looking at like really specifics. I just take a really wide look at how they're running, and just if there's something that's really obvious, I can tell that's somewhat connected or linked to their injury, then I'd just trial something, a trial like just a little bit of gait retraining. And like I said, sometimes if they have a really low cadence, sometimes increasing their cadence by 10% fixes a lot of those things.
Would you say with those sort of really smaller details like joint angles, etc., only something worth considering if you're dealing with someone at elite level who seconds might make a difference on a time or something?
That might come down to, I guess, performance rather than injury. I think if you're a recreational runner, I wouldn't focus on technique too much to increase your level of performance, but there is some science to show that if you are elite, then doing some technique training and really doing some drills and some of that really specific technique kind of work will help performance and will help efficiency, like running efficiency and oxygen economy. So yeah, I'll do that, but that's not necessarily a lot of runners. I wouldn't suggest that for a lot of runners, and it's not really a lot of the runners that I work with. I rarely work with top level athletes who want to just increase their running performance. Usually they're just injured. So yeah, I guess that would be my answer.
Winding things down a little bit now, do you advocate for active recovery, sort of cross training into swimming or yoga or something like that? Is that something that you promote with your athletes?
I definitely promote if they're not doing any of that. If they're running 6 days a week and then one rest day and they're constantly feeling tired, stiff, sore, I definitely have to switch them out with something, because we want to, first of all, we want to enhance recovery with downtime and rest and sleep. But when it comes to overall weekly mileage, we do want to keep the body guessing a little bit. We want to adapt to different loads, but we also want to load the body differently. Otherwise, you're at increased risk of developing these sort of overuse injuries. And if someone wants to still work on cardio, if they want to maintain their fitness, but want to reduce their risk of injury, it only makes sense to work the cardio, like work the aerobic energy system, but less demands on the same muscle groups that's going to lead to a likelihood of injury. So that's where cycling can just distribute a lot of the loads. Swimming definitely distributes a lot of the loads. Just doing some level of cross training it's definitely recommended. Keeping the body guessing and just doing something different is nice for adaptation and nice for just overall athletic performance, because you're just doing something different. You're challenging your neural system. So yeah, definitely advocated, especially with those runners who are just running and that's all they're doing, and they're still noticing that they're plateauing in their performance, or they're just not recovering like they used to. That's what I would recommend.
Have you got any sort of reading recommendations or anything for anyone who wants to brush up their knowledge on this side of things?
I do know that if someone is a runner if like say a health professional wants to learn more about running, I definitely check out the work by Tom Goom. He does excellent stuff. He's got YouTube videos and blogs and everything. I highly recommend that. Chris Napier does have a book. Let me see if I can find it. The Science of Running. That's pretty basic. And I'm just going to go look through my list of books. Let me stick with those. I do know if someone is interested in like the strength and conditioning work, Richard Blagrove has a book out, like it's Strength and Conditioning for Endurance Runners. And it's awesome. Covers a whole bunch of science, covers a whole bunch of myths around why endurance runners, why they don't like strength or why they don't think strength would work. Debunks a lot of those myths. And has some really nice recommendations of exercise you can actually do that can actually be really nice for health professionals as well. So if you want to look up Richard Blagrove's work and get his book, I'd highly recommend that one as well.
Obviously, there's your Run Smarter podcast. Now, you talk about a variety of different topics, and you've also got this recovery month coming up now for December. Can you talk to us a little bit about what that is and what that's going to entail?
So the Run Smarter podcast is mainly tailored for runners who want to train smarter, make smarter training decisions, reduce their risk of injury. But I have noticed that there are a lot of health professionals following that as well, because there's a lot of simple concepts that like really digestible science-based stuff. So very current with the literature that's out. And I do interview a lot of researchers and really well-renowned health professionals. So physios get they get a lot of nice takeaways to use in their clinics. I did have the idea throughout December to do a general theme, and that theme being Recovery Month. And it covers a lot of the concepts I talk about today. This is why I interviewed Shona just a couple of hours ago. So the theme being all around recovery, all the things we need to know, what the evidence shows, and we delve into a bit of murky waters, but stuff we need to really understand around heart rate variability. It's just one component that we really need to get right. We really need to understand because, like I said, athletes, endurance athletes, they get injured because they either overtrain or they under recover. It's that simple equation. We sort of tend to know the overtraining side of things. We really know we can put a value to that, but the under recovery is really murky. It sometimes goes often underappreciated. And so basing a whole month to that theme is something I'm really excited about. And the people that I'm interviewing, I'm really excited. And the overall content is top notch. So I'd recommend to stay tuned.
Absolutely. All right. Any other last little bits or bobs that you want to mention to the audience, or where they can find you as well?
Yeah, so I am active on Instagram. So Run Smarter Series is my handle. And if you are interested in learning more about the podcast, I do recommend going back to episode 1 and listening to the first 10. So in the first 10, I covered 10 principles to overcome any running injury, which really basic principles a lot of health professionals and runners will get a lot out of. So I usually recommend, if someone wants to listen, to go listen to those first 10 and then start scrolling through and finding episodes that are really relevant to them. Apart from that, people mainly follow, or they reach out to me through social media once they do a bit of research and invest in a bit of education themselves. Then if they need additional help, then I'm always here for online physio if they need. The Breakthrough Running Clinic, or breakthroughrunning.physio, is my website, the Breakthrough Running Clinic being the name of my clinic. If they wanted to do that, if they're interested in learning, or if a physio wants to reach out and just know they want to chat around how online physio works, I'm more than happy to have a chat as well. But yeah, if a runner does require some assistance, I'm always there.
All right, lovely. Oh, thank you very much. Really appreciate your time.
You're very welcome, Sonny.
Well, ladies and gents, thanks again for listening in, and we'll catch you next time. As always, wherever you're listening to this, we appreciate your time, and if you have any comments or suggestions, feel free to get in contact and let us know. Until next time. Peace.